Hello, my name is Brian Casey, editor-in-chief of AmpMini.com, and we're here at the 2019 edition of the RSNA meeting in Chicago. We have with us Dr. Seth Kligerman of the University of California, San Diego, and he's going to be talking to us about the role of radiology in diagnosing lung injuries from vaping. So there's been an epidemic of lung injuries associated with vaping over the last couple months, and radiology can play a role in that. Can you talk a little bit about what your group is discussing here at RSNA and what radiology's role is?
Sure. It's actually been going on for more than a few months. It's mostly been diagnosed or associated with vaping and come out in the press probably in the last 4 or 5 months. But we have radiologists, and first off, I want to thank my basically co-authors, co-contributors. These cases there's about 2,700 cases in the United States. No one institution has seen all of the cases. They're spread around the country. And through collaboration with multiple radiologists at multiple institutions, we've collected about now 65, 70 cases of vaping injury. So I want to thank Costa Raptis, who's at Mallinckrodt, Jeff Caney, who's at University of Wisconsin, Travis Henry, who's at University of California, San Francisco, Howard Mann, who's at University of Utah, Chris Walker, who's at Kansas University, and I'm sure I left other people off. But pointing is this is a multi-center collaborative effort because, again, these cases are few and far between. But basically, vaping has come out as a cause of lung injury. We've been noticing this. We've had cases presented from Howard Mann and from other people showing that we've been seeing these cases for a few years now, but it really has come to a level that has gained national and international recognition because it's in such large volumes. I think now at least as of last week, there are 49 deaths. Those numbers keep going up. And there have been about 2,700 cases that have been reported to the CDC. It's probably much larger than that because these diagnoses is not easy to make. It's really a diagnosis of exclusion. It's a clinical diagnosis where imaging does play a role, and you have to exclude other causes of the lung injury, especially pneumonias like viral pneumonias, or even potentially rheumatologic causes or any causes that can cause this acute lung injury. The imaging manifestations are actually, after reviewing a fair amount of these cases, again, I think we're upwards of between 70 and 75, there are some very recognizable patterns that are seen with this. The most common is what we have termed organizing pneumonia pattern, where you have diffuse ground glass opacity. It could be upper lobe predominant, lower lobe predominant, but it's almost always diffuse. It's bilateral. You get associated areas of septal thickening, but the most pronounced findings that we have seen is really striking sparing of the subpleural interstitium, so around the periphery of the lung and the center of the lung, which you can see on chest x-ray as well. And additionally, we're seeing, very interestingly, sparing of around the peribronchiovascular tissue. So around the central vasculature and the vasculature and the airways as they radiate out, we're seeing this striking sparing along that as well. Other findings we're seeing are central lobular nodules, which may be of various causes. But this is not, I have to say, we see this pattern occasionally. And there's other, if you told me someone who came in with influenza pneumonia can have a very similar looking, and you have to rule out other causes. But, we see this pattern, I would say, once or twice a week now. Sometimes, well, it's not always due to vaping, but when we see it, I make sure to tell my clinicians, have you asked about, does the patient vape? Have you asked? Is there, and it's not just, a lot of this has been associated with the use of marijuana, THC derivatives, not the plant product, but actually the various forms of God knows what they're putting in these pods to vape. Remember, vaping is very different than smoking. Smoking is you're lighting a substance and you're combusting it through fire and inhaling that aerosol, obviously very, very damaging. We know all about smoking and a lot of the damage it causes. Vaping was initially brought out as a safer alternative because instead of combusting a mixture of tobacco with lots of tar and other stuff, you're now actually atomizing or vaporizing this material without fire and without all the quote unquote, harmful byproducts that were supposed to be, I should say, quote unquote, absent in vaping, because they're not. So what we're seeing is that there are these new forms of lung injury. And what the cause is, we're not really sure. Again, most have been associated with the use of these various THC oils or juices, but we have seen some cases just with nicotine, and we have seen a lot of cases of people dying or having severe lung injury from both THC and or nicotine. So I don't want to say it's just THC; it's both. And what the cause is, we're not really 100% sure. There's been some talk about the press about vitamin E. Is it the vitamin E itself? That's a debate. I personally don't think so. I think it may be a sign of exposure, or potentially there's some other byproduct or gas that's created when vitamin E is, basically atomized and vaporized at these super high temperatures that may be causing the lung injury itself. But we're not sure. It's interesting, but imaging wise, there are definite patterns. And if you come to the talk today, you'll see a lot of these cases presented.
All right, very good. Well, it'll be good to see how this issue develops and the role that radiology is playing in it.
Thank you.
All right, well, thanks for being with us.
Yeah, no, thank you for having me.
All right, signing off for AmpMini.com, my name is Brian Casey.